Welcome, and today we are going to look at the 10 things you need to do before surgery. Number 1. You need to make sure you understand your planned procedure. Ask your doctor or surgeon any questions about the surgery that you are planning to have. Number 2. You need to ask about your medicines. If you take a certain type of medicine, including blood thinners and non-steroidal anti-inflammatory drugs, your doctor might tell you to stop taking these medications before you have the surgery. You also need to check with your doctor before starting or stopping any of these medications. Number 3. You need to discuss the pain management and anesthesia that is suitable for you. You need to discuss with your anesthetist about the appropriate anesthesia that is suitable for your procedure and for you. Ask about the associated anesthesia risks, complications, and any other questions that you have about pain management during and after surgery. Number 4. You need to sign an appropriate form before surgery known as an informed consent. Before you undergo a surgery, you need to sign some documentation, mainly an informed consent form, to indicate that you have accepted to undergo the surgical procedure and it has been well explained to you by the surgeon and anesthetist who is going to administer the anesthesia. Number 5 is that you need to discuss your allergies with your anesthetist and the surgeon. It is very important to disclose all your known allergies prior to having a surgical procedures. All allergies including food, allergy to medications, and those that cause skin irritation should also be discussed. A good example of an allergy to be discussed before anesthesia is an egg allergy, which may not seem really very important when having the surgery. However, many medications are formulated in an egg base, which also cause a serious reaction if given to you during surgery. Then number 6, if you smoke or use any nicotine products, you need to stop. Smoking and using of nicotine products, for example cigarettes, cigars, pipe, tobacco, chewing of tobacco, and dry stuff and or vaping increases the risk of serious complications after your surgical procedure. These complications will include either wound infections, healing problems, or pneumonia, or even heart attacks. The number 7 thing you need to note is that you may need to adjust your diet, and most commonly you do not eat before surgery. Once you have scheduled your surgery, ask your anesthetist if your diet will need to change in the days leading up to the procedure. Some surgeries require fasting overnight or a liquid bowel preparation, while others require no any adjustment at all. Surgeries which involve the bowel, the gallbladder, or weight loss surgeries require a change in diet both before and after based in the type of nutrition your body needs. Then number 8, you need to remove all the jewelry and dentures before coming to theater. If you wear glasses, contact lenses, dentures, or hearing aids, you need to remove all the jewelry including rings and body piercings. And please leave these items at home or with a family member at the hospital. Do not wear any makeup, deodorant, perfume, or cologne, or an aftershave before you get to surgery. Then number 9, you need to know what to expect after surgery. For some surgeries, you will go home after the surgery, but some like knee replacement might mean you need to stay in the hospital for several days. Cardiac or heart surgeries could lead up to a 3 to 6 week hospital stay followed by some rehabilitation program. And you need to ask how much pain you expect after surgery, what type of medications will help most to relieve this pain, and when you can return to your normal physical activity. If you need to see a physical therapist, how you transition back to your work environment, and if at all you need someone to stay with after surgery. Then number 10, you need to practice relaxation techniques before you get into surgery. There are lots of good relaxation techniques that you can use. Muscle relaxations, breathing exercises, meditations, and many others are all the excellent techniques that you can use. Best of all is that you can use these techniques whenever you start to feel anxious, and equally just before your surgical procedure. And in fact, you can even use them right up to the moment when you go under anesthesia.